Hey guys, Dr. Berg here. In this video, I want to talk about this concept of losing inches but no weight loss, okay? Let's dive right into this. The majority of people, when they start to lose weight, are retaining a tremendous amount of fluid. And that's why they can lose, 3, 4, 5 pounds in a week consistently for several weeks, and then all of a sudden it plateaus down to nothing. And in your mind, if you don't realize that's just water weight, you're going to be very upset when you stop losing weight. And you might even stop what you're doing. When in fact, it was successful because, especially if you're doing a ketogenic diet, you're doing intermittent fasting, that's like a diuretic. It's going to dump a lot of fluid that shouldn't be there in the first place, okay? The most you could possibly lose of actual fat per week is 2 pounds. But that's for a really healthy person. The majority of people that I see, especially in their 40s or 50s, if they're lucky, they can lose a half a pound a week. That is normal for them initially. So don't take it as a loss, but that is a normal thing and it's a good thing. Take it as something that's working. Because if you don't think it's working, then you stop. Then all of a sudden now you're back to square one when it actually was working. Because it takes time to build a healthy metabolism. So, especially if you have a history of doing a lot of diets. So we have this thing where you lose a lot of water weight and then we also go down to fat burning. I don't even like to go by weight because when you put someone on a ketogenic diet or intermittent fasting or a combination of both, you're going to spike growth hormone. That is the main fat burning hormone. Growth hormone, basically it preserves and makes protein. It helps you build lean body mass. So what will happen, you're burning some fat, you're converting some of it to energy, but then you're also holding on to your muscle protein a lot better. You're becoming less atrophied. And that protein is a lot heavier than fat. So what'll happen is, like, some people even, they'll lose their size, they'll shrink, but they're gaining a little weight sometimes, and they think it's fat when it's really not. So one of the best indicators is your actual size. You have to go by like your midsection size. That would be the most important, and also your thighs and things like that. So if you're shrinking, it's working. Give it more time. Even if you're losing 1/8 of a pound a week or whatever, just ride the wave and it'll start to work more and more and more. But the fact that you're not losing a lot of weight just tells us that you probably had a very low metabolism for years, and now you're just you're finding it out, and you're like probably more shocked. So what you want to do is you want to realize the level of effort it's going to take is maybe a little bit more than you expected. Okay, so oh well, that's just what it is. People protest this and they get really upset. They're like, it shouldn't be that hard to lose weight. Well, I understand that, but that's what we have to work on. But if you do a ketogenic diet and you don't lose weight, okay, just focus on the inches lost, because this is the most important thing right now. Over time, it will get better and better. If you're losing inches and you're eating the same, all you have to do is continue that, okay? And then all of a sudden you'll start losing some more weight as the metabolism gets better. All right? Thanks so much for watching.